Hello and welcome to the Surgical Spirit podcast. I'm your host, Dr. Haidar Al-Hakim, the Third Eye Doctor. Pull up a chair and get ready for some candid and uncompromising discussion with experts, innovators, agitators, and influential people from every corner of health and well-being. From inside the hospital to at home in the kitchen, we're leaving no stone unturned in our quest to uncover the secrets of healthier, happier, more successful, and less stressful lives. Thank you so much for joining us, and without further ado, let's meet this episode's guest. Hello, Julian. How are you?
Hi. Good to see you. Yes, all good. Thank you.
Excellent. Well, thank you so much for coming on today. And I'm just interested. Why did you call your company Dr. Julian?
Yeah, I get asked this, and actually it was not my decision initially. I didn't. It's quite embarrassing, really, isn't it? But I think we've kind of rolled with it. It was the head marketeer of Dyson that was a friend of a friend who initially, when we were asking what we should name the company, advised us around that. I mean, it was interesting because there were companies that pushed Dr. I, Doctor Now, Doctor Plus, Doctor Here, Doctor There, Doctor Anywhere. You've got all these Doctor, sort of generic type names that I felt and she felt could get lost as another one of those generic ones. Whereas what we wanted to try and do is bring a personality into it and actually a more memorable type of name. And I guess it just sort of stuck there with Dr. Julian as something you could more remember that by putting a personality behind that. And the idea of what we tried to do was the issue with therapy and online therapy especially is that it's a totally unregulated market at the moment. So, there's lots of people out there with their own websites or whatever that had no training to work online. And what we wanted to try and do is bring a level of regulation, a type doctor level of regulation into that marketplace. There's no CQC regulation for therapy. So there is no governing body as such. There's just organizations. It's like the BABCP, the BACP, and then there's an online therapy.
So it's a bit like coaching, really, because coaching doesn't have any regulations. It's just associations and organizations that take up the mantle that we are the leading group of individuals who know what we're talking about. So pay us lots of money and follow us, and we'll put a stamp on your name, and off you go.
Well, exactly. Yeah, and you can set up some sort of body if you want to. So there you go.
Yeah, I mean, there was a suggestion a few years ago when I was sort of into that kind of coaching sphere that, why don't you set up your own coaching association? Which is quite interesting because, it just shows you how pretty much the market is open for this kind of aspect. So, I mean, how do you regulate this if there's no overseeing regulation?
So for me, for my psychotherapy director, the importance of training, qualifications to work online, and also having the support structure, the governance of having supervision, and having somewhere to go, and having a structure of risk management and those types of things. So I think the problem with online at the moment is people think I'm a qualified therapist, I can just work online, that's absolutely fine, I'll work on Skype, and they go and do that. But we run a training course online, and one of the leading things is you only don't know what you don't know until you know it, which is quite interesting. And there's a lot of nuances working online that is very different. And some of the really expert therapists who thought that they were very good online made some massive mistakes, especially if you're working across countries, because you've got so many jurisdictional problems that they have to know about. But even just working within the UK, there are still quite a few.
Could you give me some examples of those things, Julian?
Well, I mean, if you're working with someone in Ireland, you've got to know about the abortion rules there. If someone's going through an abortion, there's sort of things like that where they could say really the wrong thing and get people into serious trouble. They can be breaking laws. If you're working with someone abroad, that certain video connections or whatever are banned, you've got to be careful of how that works. You've got to understand how do you manage someone who's going to kill themselves in Abu Dhabi when you're in England. So would someone who works face to face understand the ways of how to manage that in a safe way? unlikely. So because they've got to have established the correct safety pathways with that patient from at the very beginning, understanding who their doctors are, who to contact, because it's about making sure that you've got people you can contact to keep that person safe, basically. And even even simple things in the UK, like camera positioning. So if I put my camera down, you'll only see my chest, whatever. I mean, that's very simple. But then also being in a room where no one else can observe you or hear you. So you're speaking about confidential things. You have to make sure that no one is behind who can see that person. You have to be in a room, a separate room. That's that sort of thing. And sometimes you get patients that are in the supermarket on the app, just trying to do the therapy session. That's not necessarily the appropriate place to do a therapy session. So yeah, you've got to be a little bit careful on that.
And in terms of online therapy and face-to-face therapy, I know previously online didn't exist, and now it's here. I mean, how do you see that playing out? Do you think more and more people will be using online, or I guess it depends on the demographics and the condition, but sort of given that you've been in this game for some time, how do you see this playing out?
Well, I guess I see it as the future. I mean, as we know, technology has got so good now, and the internet has got so much better. With we're going to get 5G or whatever. So the fact is, in the past, where the connection was poor, it doesn't really work. And you and I are chatting now on Skype, and as you say, we've built up a relationship. You were commenting how you felt it's less intimidating being in your own home than speaking to someone face to face. So some people, when they can see the therapist and they can have that therapeutic relationship, you can actually get a better session out of it. You can have your dog on your lap, in a comfortable environment, and you can talk to the therapist. I mean, the platform what I wanted to set up was giving patient choice back, so they can choose whether they want their video camera on, because some people feel intimidated having their camera on, or they're not willing to have the camera on at that point, and they would just want to talk. Some people don't even want to hear the voice, and some people prefer doing messaging, therefore they can also do that. And what's fascinating about the evidence is there's good evidence out there now showing that the video connection, even when it was a poorer connection, when they did this research, they had the same or better therapeutic relationship and better clinical outcomes with better satisfaction. And now the evidence coming out on texting is also better, despite the fact you'd think that would be, it's down to patient preference for me. I mean, if they want to do that, then they should be able to do that, and we shouldn't be dictating what is best for the patient. The patient has to choose.
So essentially, the more choice that they have in these aspects, the better the results, maybe.
Well, yeah, I mean, that was my thinking behind it. So the reason I set this up in the first place was I was frustrated as an A&E doctor seeing so many people coming in trying to kill themselves. And on speaking to them, the main reasons were I just haven't been able to stop. I'm on a waiting list for therapy, or the NHS do a great job, but we are very limited resources, especially with therapy. The waiting list of 6 months or whatever is crazy, and they're not seeing the right people. So they're seeing someone that comes and does a risk management tick box, and then they feel ignored because they're just doing a tick box and they're not actually dealing with the issue. So the way you can treat these people is actually dealing with their problem and having the correct specialist who who can actually deal with that. So what I found, if you have a platform that has all these specialists on there, and you can have unlimited number of specialists because it's a platform, then patients can choose the right specialist for them, and they can be matched to that specialist. So we have matching fields that match them to that, and then they can choose the therapist that's right for them, and they can speak to them beforehand to make sure that you're getting the matching right. And that just means that you're able to to build that therapeutic relationship from the start, because you're giving the patient back that power. They're also booking the appointment time, so they're going to actually turn up for the appointment, and they can have it whenever they want, so out of hours, or and then they can have it from home. So it means that hopefully you see a lower DNA rate.
Yeah,
that was the thinking behind it.
And it's quite interesting that previously you had no say in who you get as a therapist, and there's very few therapists out there when you don't even have the choice. But I think there's sorry, I've had this lurgy for for some time, but I'm getting over it now. Therapists. I mean, I think there are more and more therapists now, whereas before it wasn't such a kind of a profession that people would even talk about. But now we have so many therapists out there, and it's much more acceptable to not just see a therapist, but actually be one as well. Which is
definitely.
Which is quite interesting. I think this sort of notion that even self-therapizing and just sort of being more acceptable to talk about therapy. But then it brings us back to who's a good therapist, and how do you regulate things, and I think that will develop over time, with companies like yourself and other enterprises, and this is where innovation comes in from enterprises like yourself, rather than big institutions like the NHS. And have you been kind of spearheading that? Would you say, are people looking to you for innovation more than the NHS?
Well, I guess we're trying to set the standard of regulation for online therapy and we've been well recognised from all the institutions that you've mentioned before, as that's luckily we're getting a reputation now for setting the standard, because of our training and our governance levels around that. But yes, I think we know how difficult it is to innovate within the NHS. I got frustrated being in the NHS. Doing that. I'm still an NHS doctor, but I decided the way to innovate was to create a company to be able to do that, because I saw the way around that. And now I'm now selling back into the NHS, but people, that gets a very bad reputation of selling back in, and I think what we have to understand is NHS basically subcontracts everything it does. Even in our hospital, all the bed sheets, everything is subcontracted. And what we can actually do by using the online platform is save them a third of the price. So it's able to be much more cost effective, as well as hopefully better for patients. So that's where my thinking is, and that's what we've seen in our trials that we've done so far within the NHS that are now ongoing. So
that's quite interesting. So you in the NHS, and yet you come out to innovate and then pass it back into the NHS. So that's sort of a really good example of how doctors who are interested in innovating in the NHS and yet frustrated by the system, there's a way of working in both, essentially, influencing and innovating at the same time.
Yeah, exactly. And they have set up now they're trying to get a lot more innovation done within the NHS, which is great. I mean, they're setting up certain hospitals, certain trusts have sort of innovation hubs and things that you can do, but they don't really give you a great level of support, to be fair. I mean, I can't comment on, I've just seen what some of them are. So if you want to do it, you really have to just go out and do it yourself. I mean, there's no other way of doing it, really.
It's much quicker. It's much quicker. You learn a lot more, and you get to see the outside world, because it's a massive world outside the NHS. And that's something people don't necessarily appreciate when you're in the NHS. You think, it's sort of, that's it, that's all I've got. But actually, once you take even half a step out of the NHS, you think, wow, there's so much opportunity here for innovation and just being yourself, really, rather than part of the whole system.
Totally. And the best people to do this I think are the people that work in it, right? So the doctors, the nurses, the pharma, everyone. And the point, we all do QI projects, don't we? And we go, oh, okay, well, I've improved that. But actually look at what is going wrong in your area and go, okay, actually, let's look at this on a wider scale. Is there something that could really improve this? If you have an idea, honestly, just go for it. I mean, there's a great there's a clinical entrepreneur program set up by Tony Young that you can join that gives you some support. And then there's all these accelerator programs. But I think you have to sort of get yourself going initially. But yes, it's.
What are the three sort of steps that you would advise someone who has an idea, works in the NHS, and just thinks, shit, I'm not getting any shit done here. How do I go? What are the three top tips?
The biggest barrier is going to be finding finance. I was able to raise between family and friends, luckily, to start off, just to get a minimum viable product. So it depends on what you want to do. If you want to build an app or you want to build a platform or whatever, then you need money to get that going to start with. I mean, the best thing to do always is to test, do your market research and to test out a product that hasn't been built properly or isn't, if you can do it on a piece of paper to test it first, do it on a piece of paper. Don't build something that doesn't work. or isn't needed. And I think, be careful with building apps, because there are how many thousands, hundreds of thousands of apps out there now that are, and they're now trying to regulate those apps into healthcare libraries, but even those apps don't get seen. So just be careful building a random app, because make sure it hasn't been done already. And if you feel like it's a real innovation, then definitely, but test it out as simply as you can to start with. You then need to try and build a minimum viable product, which involves getting some funding together, maybe through family and friends, and build it as cheaply as possible. Again, it's always about testing it, see what the interaction is, and then once you've got some traction in that, then you can start to, you've just got to keep building up from that minimum viable product. But the biggest thing is just thinking people can't do it. You can do anything you put your mind to, so you just need to just go out and do it. It's a lot of hard work.
So changing that mindset, that this is impossible to, well, this is possible to, yeah, do you know what? I've started this, let's keep going. And what made you keep going in this sort of, because it's very difficult, being in this situation.
It's so frustrating. I get very frustrated sometimes as well still. And we're still early days, we're very early days. I'm lucky we've got 2 NHS contracts now, and that's great, but we're still early, and we've got backed by some accelerator programs and things. But we still haven't done a big external raise yet, which we need to do. But we wanted to prove the concept. But I think what keeps you going is sometimes you get the patient satisfaction from it. So I had a patient phone me up saying, "You've transformed my life. Thank you so much. Keep doing what you're doing." That gives you motivation, of course. You've just got to, as a lot of the things is about, we're talking about burnout. I'm a very prone risk to burnout, because last year I was trying to hold down a full-time job in GP training, and because they wouldn't let me go part-time and run the business, which is impossible. Luckily I'm now part-time. You just got to keep going from what your vision is. So you've got to see the thing, and you just can't give up. Meeting quite a few successful people, like Jean from Touch Surgery, who I know quite well. His biggest piece of advice to me again was just keep going. If you've got the vision, you understand it, you just got to keep going. And there will be so many barriers, so many people saying no. The NHS is a prone culture to middle management blocking it. If you've built something it needs, then they will want it. And you don't have to sell into the NHS either. I mean, there's other markets. That's the point. And don't just narrow your market to one area. Like we're working with some insurance companies, building up from that, and other corporate companies as well. So you don't just narrow your market. See where it's going, but then have some focus, working out where it's best to go to.
Yeah, definitely. I mean, the bigger your net, the better. I mean, that's my philosophy. You've just got to throw that net out. And I think this thing about being super niche and what have you, and cornering your market and all that, I think that's old news now. No,
definitely. And we sort of went across the whole market, but we had to pivot quickly, because we basically initially were there for the private market setup, but actually I then realized quickly we didn't have enough resource to market effectively. And unfortunately, I think in this country we're not getting enough people paying for their own therapy, so it's very difficult to get it out there enough to get people buying. And they can still pay for it privately on the platform. Anyone can log in and pay for it, but it's difficult to make a real business out of that. So where I saw the biggest market opportunity, and where my original passion was, is to try and get this into the NHS, where I think where it could save money. But there's also the corporate sectors. I mean, you're at risk of, if you spread your net too thinly, of not getting anything done. So what you have to do is find where it's working initially, and then focus on that area to start with, and then build it up from that. So currently what we're doing is we're focusing now on the NHS and insurance areas, and building up from that, because those are the 2 areas that we think are the biggest potential for that. But yeah.
And you seem to be quite business savvy. Where do you learn all this sort of business stuff from?
I don't know. I've always been. My dad was an entrepreneur.
Right.
He set up Our Price Records back in its day, which was an old music chain shop. Luckily, sold that on a long, long time ago before the internet came out. But yes, I think I had a flair for wanting to do something entrepreneurial, and rather than just being a doctor as well. But I think reading, I've read a few books. can't really name. You just pick it up along the way, and
you just got to do it, mate. Basically, you just got
to do it. Yeah,
you just got to put yourself in the middle of everything and just learn as you go along, and just failure, and just
failure. We do. I've not done a single business course or degree or anything,
wow.
You just got to. I don't think you learn business by doing the business. I think, and having common sense. So for a business to work, it's profit and loss, right? So you've got to work out, and that's pretty easy to understand. So it's sort of understanding where that could go.
So what are your three, I mean, we're coming towards the end of the podcast. What are your three top tips to sort of doctors who want to get into business and are having cold feet, or, really interested, but they still think the NHS is the be all and end all?
So I think for the NHS to move forward, you have to innovate. For that to happen, you have to have. So the first thing is, don't be afraid of doing something. Go for it. If you fail, and most of us fail, and we're always going to fail, then pick yourself up and read it. And don't be afraid of failing. Yeah. That's the thing. People are afraid of. Just don't be afraid. Just give it a go. Like, nothing won, nothing lost. Just go for it. Yeah. Nothing gained, nothing. Whatever that's saying. As I kind of remember saying. But yes, go for it. I think number one. Number two, really find the need. Yeah. So, and understand the need. Yeah. You understand the need because you're working in it, but understand that how this need can be fixed. Don't try and fix something that doesn't exist, and don't try and do something that isn't going to be able to be turned. It isn't going to work. So, for you to run a business or to get investment to be able to help the NHS, it needs to be investable. So it needs to do your numbers first. So make sure that it can be profitable. And I think those are probably the two biggest steps.
And the third one?
And the third one, keep going.
Yeah, I mean, it is a marathon at the end of the day. It's like life, business like life. It's not as if, that's it. You just got to keep going, because that's the only way for things to change and for things to be positive and something to that. I mean, for me, it's about legacy. For other people to sort of be talking about the stuff that that you're doing, that really pushes me on and keeps me going even in the, in the most darkest of times. Great, Julia. How can people get hold of you and find out what you're doing and all that stuff?
Well, the website, if you want to have a look at it, is www.dr-julian.com, or just Google Dr. Julian. My email is julian@dr-julian.com. Very happy for anyone to email me. You can also get hold of me through the website. But yeah, check it out. We are expanding into the NHS, and we work privately, and trying to improve access to mental health. So it'd be great. We're also looking to expand the team. So anyone interested, get in touch.
Wonderful. Thank you so much, Julian.
Great. Well, thank you again.
Bye-bye. Thanks for listening to this installment of the Surgical Spirit podcast. For all the latest in the world of surgical spirit, don't forget to follow on Twitter @The Third Eye Doc, and catch me on Facebook at the page The Third Eye Doctor. You can visit the website at www.thethirdeyeDoctor.co.uk for more information on the work that I do. And please send us feedback and questions and suggestions for the podcast. It's always a pleasure to hear from you. I've been Dr. Haidar Al-Hakim, and I'll see you next time.